Hey guys, this video is going to be about exercises to help with mobility and strengthening for knee arthritis. The first exercise is a quad set with self-mobilization into extension. So really what that is trying to get the knee straight. A lot of times when I have clients that come to me for arthritis in the knee, they are lacking full knee terminal extension. So meaning they cannot get their knee straight completely. So usually it looks something like this. That's their extension and they can't straighten it out anymore. So this is a nice exercise to work that. So all you need is a chair. All you gotta do is just prop it up. Let's just say I'm working on the left leg. So you wanna go ahead and have space on the bottom here so you can push the leg down as far as you can go. So you're gonna take this top hand, you're gonna rotate the femur this way, and you're gonna take the other hand and you're gonna grab your shin bone and you're gonna rotate it that way. Really, you're just getting a skin tug on it. You're not cranking on it. You're not gripping it super hard. You just want a skin tug. So for me, it's just that. Just applying a external rotation force on the femur, and then you're just applying an internal rotation force on the tibia. That's really all you're doing, or your shin bone. So you basically take that, grab it, rotate it that way, take this, grab it, rotate it that way. Hold that, and I want you to actively grab, have your leg and push down. And as you push down, you should feel the kneecap move. And as you have the kneecap move, I want you to use your arms and apply a little bit of pressure downward, straight down this way. Hold it for about 3 seconds or so, about pressure on, and then off. Pressure on, 3-second hold, and then off. If you can tolerate this a little bit more, you can hold it for a little bit longer. This is a nice, basically self-mobilization while you're actively doing the quad set, and then off. So by actively doing the quad set, you're basically squeezing this muscle here. So you're actively making this tight, and you're applying, using your hands to help push it down and giving it a rotational force to it, because in order to achieve full terminal knee extension, you need a little bit of external rotation and at the knee. So that's what we call terminal knee extension. Now we're gonna go into some basic strengthening for the knee. So the first one is the classic straight leg raise. So you lay on your back, the opposite leg is bent. We're working on the left leg here. Point your ankle towards you so you develop tension in the back of your leg here. You lift it up to the height of your other knee, and then you bring it down, tap the heel, and then bring it right back up. I usually have my folks do this 2 sets of 15. So first set of 15, have them rest a little bit, and then another set of 15 after that. The key with this is you're bringing this all the way down, but as you bring it up, you want the leg locked straight completely. You don't want a little bit of a bend here. That doesn't really engage the quad all that much. You want it all the way because you're also trying to facilitate extension. Next exercise is a heel slide with a ball. This is more of an active assisted exercise because you're using the strap to assist the bending. So this exercise particularly works on flexion of your knee. So all you're really doing is grabbing this out. You can bend this other knee for support, or you can keep it straight. It's really up to you. But for the purpose of this, I'm gonna leave it straight just for demonstration. So you grab, you have the strap hooked on, and then you just bring the ball towards you by pulling on the strap. We're really trying to maximize the bending of the knee. Hold it there for about 10 seconds, and then you just let go. The ball will rebound. You can still have control of your leg, and then you repeat. Get it for as far as you can go, 10-second holds, and then you just let it rebound. And then I usually have my folks do this about 10 times to work on the bending. Next one is the classic bridge to work on strengthening of your glutes. So you want your legs about shoulder width apart. Once you have that about shoulder width apart, you want to squeeze your butt first to engage those glutes and then come all the way up. You should feel this in your butt, not your back. So bring it down slow, just don't come collapsing down. Bring it back up again. You can hold it at the top, couple seconds, make sure you engage those glutes, and then bring that down. Again, 2 sets of 15 is what I usually have people shoot for. The other thing is you don't want your legs all the way out like this when you're coming up, because now you're biasing different parts of the glutes. You just want this about shoulder width apart in terms of where your knees are, how wide they are, and then you bring that up and then bring it down. Right after you're done with the glute bridge, you want to turn it into a hamstring glute bridge by working on the back of those muscles on the thigh there. So if this is the glute bridge, you want to turn this into a hamstring glute bridge, biasing those muscles in the back of the thigh there to get those hamstrings. All you got to do is straighten them out a little bit more, creating more of a longer lever. And then from there, you do the same thing. You still do your bridge, you press down with your heels, drive them down to the mat or the floor, and then you come up. You should feel that in the back of your thigh a little bit more. You can hold that for a little bit and then bring it back down. Same thing. 2 sets of 15 when you're doing this, or a set of 10 depending on what you can and cannot tolerate. Again, with all these exercises, none of this should be painful. It should just feel like you're working out. Last exercise is standing. We want to work on the hip abductors, which is basically your glutes that are off to the side. So this is a nice lateral stabilizer, which then puts the femur in a good position, so the knee is in a good position. You start with a band already pre-tensed. So you want to, by doing that, you want to just open up your stance a little bit, so there's already tension. And you get into a semi-squat position, just like this, and then you go. So take note, you're not really doing this, because if you do this, then the tension on the band is gone and there's no longer engagement of those muscles in your glutes. So you want to maintain a space. Keep the band tight is what you want to do. So usually I have people do this for about 2 long laps. So you have a long hallway in the house, this would be a nice way to do it, or just do multiple laps, or just 20 times one way and 20 times the other way. So that way you can get both sides of your glute. Remember, when you're doing these exercises, it should not be painful. It should more so be an exercise pain. You should just feel the burn. You should feel the muscles that are engaging. It shouldn't be anything when you're doing these. If you're on your 4th rep, if you're burning and you're having a little bit of pain, and then on your 6th rep, and then you have more pain, and then you're on your 7th rep, it's sharp stabbing pain, that is your cue to stop. So you should just move on to the next exercise if that is the case. That's all I have for you guys. Let me know if you have any questions. Leave them in the comment section below, and I'll see you guys in the next video. Thanks for watching.